This is the case of Ebstein's anomaly. You can see this right atrium, right ventricle. This is also right ventricle. So this part is atrialized right ventricle because this part is in connection with right atrium, but there is no valve in between this. So this is the atrialized right ventricle. This is right atrium, and this is true right ventricle. And this is septal leaflet of tricuspid valve. And in this side, if you see, that will be anterior leaflet of tricuspid valve. So septal leaflet or is shifted towards the apex. So in case the septal leaflet is shifted towards apex by more than 7 millimeter uh, per meter square, in that case, you can say it is Ebstein's anomaly. Again, next image, you can see here the tricuspid jet is coming. So the jet position is quite close to apex. That you can say low lying TR jet, a feature of Ebstein's anomaly. Velocity across TR is usually low. Again, you see the same thing. This is right atrium, this is atrialized right ventricle, this is true right ventricle, this is left ventricle, this is left atrium. So right side is quite large compared to left side. You can see the same thing. This is main pulmonary artery, this is right ventricle outlet, this is atrialized right ventricle, this is true right ventricle, true right ventricle and right ventricle outlet almost same thing. Main pulmonary artery relatively quite narrow, that is normal in size, that is not dilated. So whenever you see main pulmonary artery, you will find normal size pulmonary artery. You can see here this is grade 1 pulmonary regurgitation. So whenever you find tricuspid valve shifted towards apex more than 7 millimeter per meter square of body surface area, in that case it is Ebstein's anomaly. In this case, it is almost 30 millimeters shifting from this to this is approximately 30 millimeter. This is septal leaflet of tricuspid valve. This is anterior leaflet of tricuspid valve. Anterior leaflet. This is septal leaflet. This is anterior leaflet. Whenever repair is needed, in that case, this anterior leaflet has to be free and mobile, and a good amount of leaflets should be here. Anterior leaflet should be good amount, that should be free. Free means not attached with the wall, that is free anterior leaflet of tricuspid valve, that is required for construction of the valve. If valve construction is required, when there is problem in the patient and valve construction is required, in that case you need free portion of anterior leaflet of tricuspid valve for repair, and that portion is utilized to repair the valve. You can see there is a LV is D-shaped. You can see TR jet. So this is the case of Ebstein's anomaly. In Ebstein's anomaly, you usually you can see some sort of atrial septal defect also. In this case, there is atrial septal defect. You can see the atrial septal defect now. Size is 19 millimeter. This is flow across ASD. Flow is bidirectional. That means flow from right to left and left to right also. So bidirectional flow, patient is cyanotic, because whenever the flow is from right to left, that means there is cyanosis. So flow is bidirectional through ASD. Patient is symptomatic. ASD is also present in this case. This is a typical case of Ebstein's anomaly.